So today let us discuss one more topic, a high heel topic for your entrance exam. Okay, a 45-year-old male with progressive dysphagia, retrosternal pain, and regurgitation. Okay, so various images are given. Okay, initially first we'll see the barium swallow. This is a barium study. It's a barium swallow study. Okay, what does it show? It is showing a filling defect, right? It's showing a some smooth filling defect, right? There is passage of some contrast into the lumen, so it may be indicate some ulceration. Okay, so let us have some other clues from the pictures. So this is the upper GI endoscopy finding. So what does this show? It shows a submucosal bulge seen in the lower 1/3 of esophagus. Okay, this is classical of your leiomyoma. Okay, so this is the chromoendoscope with your Lugol's iodine, which stains the leiomyoma on the endoscope. Okay, and this image is very important and could be the investigation of choice. That is your endo ultrasound, where you can see the bulge that is arising from your muscularis propria. So only on endo ultrasound you can tell the mass, the submucosal bulge is arising from which layer. So the investigation of choice will be your endo ultrasound. One more thing I want you to remember is biopsy is not done in view of bleeding. Okay, and it could be of difficulty in the management. For example, when you are planning for enucleation, if we do a biopsy, then it will be difficult for us to do a proper surgical excision. Okay, and this is the surgically excised specimen through your endoscopic submucosal dissection, that is called as ESD. Fine. So let us look at some types of the leiomyoma. So as the pictures here clearly shows, it arises from the smooth muscle of the esophagus. Okay, so it could be either intramural, which is the most common presentation. It could be sometimes luminal, sometimes extra esophageal, and if it is annular, it is going to cause your dysphagia. So since it is arising from the smooth muscle, so what you would expect on the histology? So it will be positive for SMA, right? It is positive for SMA and desmin, right? And this is the again one more picture showing a endoscopic submucosal mass common in lower 1/3 of your esophagus. So to summarize, right, your leiomyoma, it is seen on endoscopy as a submucosal mass, right? Most common site is lower 1/3, and one more thing I want to remember, it is most common in males, like 3:1 ratio when compared to females, right? Most common risk factor is being smoking. It could be intramural, which is the most common presentation. Sometimes could be annular or intraluminal, right? And the investigation of choice will be your endo ultrasound, where you can see a muscularis propria. So how will you describe this lesion? It is a hypoechoic lesion. Hypoechoic smooth walled lesion arising from your muscularis propria. Hypoechoic homogeneous smooth walled lesion arising from your muscularis propria. So endo ultrasound is the investigation of choice. The treatment is usually when the size is more than 5 centimeter, if even asymptomatic. Okay, if symptomatic, okay, and it is less than 5 centimeter, like say 2 to 3 centimeter, then you can go for endoscopic submucosal dissection. Okay, and the larger tumors, like more than 5 centimeter giant, can be done. Surgery is done is enucleation through VATS. So this is the management of your leiomyoma. Your leiomyoma of the esophagus. Okay, thank you for watching. So in the next